important story, a respiratory illness in children, and doctors say it is surging like never before. It is called RSV, and the CDC says cases detected by PCR test have tripled in the last 2 months. It's putting a strain on many hospitals across the country. Joining me now to talk more about this is Dr. Krupa Playforth. Dr. Playforth, thank you so much for being here.
Oh, it's my pleasure.
Why are hospitals seeing such overwhelming numbers of cases of RSV right now?
You know, I think that there are a few factors at play. First, with the social distancing of the last 2 years, many children did not have any primary exposure to RSV. So this year, we're seeing a large group of children that are being exposed for the very first time. And then all of our protections and our precautions from the past few years were lifted around the same time that the weather changed, children went back to school, and the world kind of resumed some sense of normalcy. So it's not surprising that we're seeing such widespread infection transmission across communities.
Well, it is the first time that we've heard about hospitals being overwhelmed like this since, certain points during the pandemic. Could hospitals be reaching that critical level of unavailable beds in some parts of the country?
I think that many institutions are at that point. I'm hearing reports from all across the country of pediatric patients that are being rerouted to hospitals sometimes several hours away because their local hospitals have no beds.
What would you recommend to parents watching right now who are concerned about their children potentially getting RSV?
I have a couple things. So it's really easy to panic when you see news headlines like this. It is important for parents to know that the vast majority of children will be infected with RSV by the age of 2, and most recover just fine. We get most concerned about the young children, those who are under 6 months, or those who have underlying health issues, prematurity, lung disease, heart disease, immunosuppression. Those are the children that are going to be at highest risk for hospitalization. And then otherwise, I think parents need to just exercise the same precautions that we've been talking about all along. Wash hands. It is the single most important thing you can do to decrease RSV transmission. Keep your child home if they're sick, and then trust your gut. If your child seems like they're not doing well, it is always important to reach out to your pediatrician.
Yeah, can you explain what is the threshold past which you need to actually contact a physician or bring your child in to get checked? It's not enough just to keep them at home and keep taking care of them.
So for a lot of children, RSV is going to look like a pretty severe cold. But what we worry about is when they start to show increased signs of work of breathing. And what is important to know for parents is that the infection tends to get worse before it gets better. So it's usually around days 3 through 5 of illness. That's the low point. That's when you're going to start to see signs like increased, more rapid breathing, more retractions, or grunting, flaring with each breath, or dehydration is another reason that many of these children are admitted.
All right, Dr. Playforth, thank you so much for your time. I appreciate it.
My pleasure.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.